Now, here's a big question. Can diabetes be cured?
Well, diabetes can be managed.
Managed, okay, that's the word.
Diabetes can be managed. Now, unless you get a pancreas transplant, of course. But other than that, diabetes can be managed. It's if you diet, exercise, take your medication, it can be controlled. And that's one of the great things about that illness is that it's one of the few that you have control over, whereas with cancer, you may not have control. Diabetes, the patient has the complete control of managing the illness. So you can live a long and healthy life.
Right.
Especially in the beginning stages of diabetes, when it's pre-diabetes or when sugar is high, however, there's no complication that occurred yet.
And it can be managed. I mean, the role of blood glucose, Dr. Vladi, if you can talk a little about blood sugar, blood glucose, what does that mean?
Well, blood sugar, if I may interrupt.
Yes, go ahead.
So we call blood sugar glucose. And the problem with when it's too high with diabetes is that it can cause damages to the vessels in our body, and which can lead to like heart attack, stroke, eye problems, kidney problems. So that's that's how it's prevalent in this illness.
Okay.
Right. And the blood glucose comes from eating. So if you're eating fatty foods, high carbohydrate foods, that's one of the main issues that causes your sugar to rise.
Okay, so which brings me to my next question, which is insulin. So we hear that term as well. So what is insulin, and why does our body need insulin?
We absolutely need insulin to help bring that glucose into our cells. So that way we can have energy, we can grow, we can, when the insulin's not working, the sugar hangs out, and that's when it causes the damages.
We don't want the sugar hanging out.
No, we don't want it hanging out.
No, we don't want it hanging out.
No.
So how does our body make insulin?
It's produced by the pancreas.
Okay.
Yeah, and the pancreas is the organ I was saying earlier, right behind our stomach. And a lot of diabetics who either have problems with our pancreas, it causes decreased insulin production or insulin resistance.